A few moments later.
Doa Hasan kaçın mı?
Ontem eu acho que eu disse sempre dizer.
Doza.
A few hours later.
Very boring minutes later. Days later.
A few hours later.
Allora, in chiaro non mai. Ask you come the call you listen.
Longer than a few minutes later.
Tutti abbiamo se stessi. Non sono io.
Se vuoi avanzare su. Andate. Dove morrucci dei morrucci padine a주 büyük şey olduğunu da. Bu şeyler olmuş oldu. Konuşsana koştu.
Ya, dur.
Seems like your symptom points out that you have toxocaris infection.
Well then, let us dive into the world of Toxocara canis to understand it, shall we?
Toxocara canis, it is also called as dog roundworm, and it is a parasite that lives in the host for to draw the nutrients from the host and to complete their life cycles. Let's look into the classification of Toxocara canis. It falls under kingdom Animalia, phylum Nematoda, class Sarcinidae, order Ascarididae, and family Toxocaridae, and genus Toxocaras, and species Toxocaris canis. Let's look into the geographical distributions of Toxocaris canis, and it is worldwide distribution, and it is commonly found in all domestic dogs and other canis, and it is also possible to have prenatal infections of puppies. We talk about the morphology of Toxocaris canis. It is large, cylindrical, and nematode with a smooth, unsegmented bodies. Adult worms exhibit sexual dimorphism with with female measuring 9 to 18 centimeter in length and male being slightly smaller at 4 to 10 centimeter. Body is tapered at both ends, with anterior end being more pointed than the posterior end. Now, if we look above the external feature of Toxocara canis, it is thick and multi-layer, providing protection and support for the worm. Fine transverse serration can be also observed on the cuticle under microscope, giving a serrated appearance. The mouth is located at the end and surrounded by three lips, giving it characteristic appearance known as tri-bellied mouth. Eggs of Toxocara canis are produced by adult female worm residing in the small intestine of infected dogs, and it is oval in shapes, and it measures 75 to 85 micrometer in length. They have thick, striated outer shell that provides protections and helps them to survive in the environment. The eggs are typically light brown in colors, making them difficult to spot in fecal samples with a proper staining or microscopy. Egg of Toxocara canis are not infected when the first excreted in the feces. They require a period of incubation in the environment, usually 2 to 4 weeks, to become infective. Once infective, the egg can survive in the soil for months to years, depending on the environmental conditions.
Now let us do a brain break by testing ourselves with a quiz. Think about the answers and check if they are correct. How do adult worms of Toxocara canis exhibit sexual dimorphism? A. Females and males are the same size. B. Males are larger than females. C. Females are larger than males. D. They have no size differences. The answer is C. 2. What is the shape of the body of Toxocara canis? A. Flat. B. Round. C. Cylindrical. D. Irregular. The answer is C. 3. What can be observed on the cuticle of Toxocara canis under a microscope? A. Longitudinal lines. B. Transverse striations. C. Smooth surface. D. No visible features. The answer is B. 4. Which order does Toxocara canis belong to? A. Ascaridida. B. Nematoda. C. Sessanentia. D. Animalia. The answer is A. 5. What is the family classification of Toxocara canis? A. Nematoda. B. Sessanentia. C. Ascaridida. D. Animalia. The answer is C. 6. Where is Toxocara canis commonly found geographically? A. Only in North America. B. Only in tropical regions. C. Worldwide. D. Only in Europe. The answer is C.
Okay, now let's continue with the life cycle of Toxocara canis. The life cycle starts with puppies. Aren't they cute? But it turns out that they're not cute because they're filled with worms. Giant worms that look almost identical to human ascaris, the round worm. And just like in humans, what do these worms do? They have sex and they lay eggs, and these eggs make their way into the dog poop into the soil, where they will, over a period of days, embryonate and mature and become infectious. And the natural life cycle is that whoever comes along next, another dog, and just like in human ascaris, instead the dog, egg is eaten, makes its way into the intestines, where it will hatch and turn into a larva. The larva then gets into the bloodstream, gets swept up into the lungs, where it will molt 1 or 2 times and then get coughed up and swallow it back down the esophagus until it matures in the intestines into an adult worm, where a boy meets the girl, and where they mate, they reproduce eggs, and the reproduced egg comes out in the dog poop, and they make their way back into the soil and eventually embryonate and mature and become infectious. Now that's animal veterinary medicine. In human medicine, the story is as you would expect. What if a person comes along instead of a dog and eats the dog poop as well? It gets swallowed and into the intestines, but that's where things change, because these worms have evolved from dogs, not humans, and that means that they cannot really reach full maturity inside the human being. Instead, what they do is wander around looking for the next phase of life, looking for a dog alone. They go through our liver and our spleen and just about any other visceral organ, or they go to our eyeballs and go through our eyes trying to find the lung of a dog. They don't find it, but along the way, of course, they will elicit a significant inflammatory response. If they go through your guts, we call that visceral larva migraines, and if they go through your eyes, we call it ocular larva migraines. So this is known as zoonosis. It's very closely related to human ascaris. Hopefully, we are the dead end host because the adult worms can never form and reproduce. The disease is due to larval migration in our viscera and our eyes, and if you are a cat lover and not a dog lover, yep, there's another worm called Toxocara cari, and it's basically the same exact thing. Now, let's talk briefly about the distribution of this parasite to keep you updated. Now, where does this show up? Any place on planet Earth where people eat dog poop or cat poop, and that's usually young kids because they're playing in a sandbox or eating dirt like normal kids are supposed to do. And in the United States, it is about 50% of all American kids who are positive, but in other countries in the tropics where there is less sanitation, such as Brazil and Indonesia, positivity rates are as high as 40%. 40% of the people in Brazil and Indonesia have had this infection. That's pretty high.
Let us again have a short quiz to help you understand the life cycle of Toxocara canis better and to also keep you updated. 1. What is the initial host in the life cycle of Toxocara canis? A. Cats B. Humans C. Puppies D. Birds. The answer is C. 2. Where do the eggs of Toxocara canis end up after being passed out in dog poop? A. Air B. Water C. Soil D. Food. The answer is C. 3. What is the next step for the eggs of Toxocara canis in the soil? A. Embryonate and mature B. Disappear C. Multiply rapidly D. Freeze. The answer is air. 4. Where does the larva of Toxocara canis end up after being ingested by a dog? A. Lungs B. Brain C. Intestines D. Heart. The answer is C. 5. What happens to the larva of Toxocara canis after being swept up into the lungs? A. Molt 1 or 2 times B. Die immediately C. Stay dormant D. Multiply rapidly. The answer is A. 6. Where does the larva of Toxocara canis mature into an adult worm? A. Lungs B. Intestines C. Brain D. Heart. The answer is B. 7. What is the final destination of the eggs produced by adult worms of Toxocara canis? A. Water B. Air C. Soil D. Food. The answer is C.
Toxocara canis: symptoms, treatments, diagnosis, prevention, and complications. Outline: number 1, symptoms; 2, treatment; diagnosis, complications; prophylaxis, pathogenicity, and past research on Toxocara canis. Symptoms: ocular larva migraines. Infection can cause inflammation and damage to the eye, potentially leading to visual impairment. Visceral larva migraines. The larvae can migrate through the body and affect vital organs, causing fever, abdominal pain, and organ dysfunction. Third one is neurological complications. In rare cases, the larvae can reach the brain, leading to seizure, meningitis, and other neurological disorder. Number 2, treatment. Treatment undertaken is albendazole and mebendazole tablets. These are broad-spectrum medications commonly used to treat parasitic infection, including Toxocara canis. They work by disrupting the parasite's metabolism, leading to their death. The choice between albendazole and mebendazole may depend on factors such as drug availability, cost, and individual patient factor. Treatment duration and dosage are typically determined by the healthcare provider based on the severity of infection and patient's age and weight. And corticosteroids in case where there is significant inflammation or tissue damage due to migration of Toxocara larvae. Corticosteroids may be prescribed. 3 is diagnosis. Diagnosis is done by blood tests and detection of antibodies in the blood. Diagnosis involve blood tests where Toxocara specific antibodies are detected, and imaging techniques are also used. Prophylaxis. First one is pet deworming, Regular deworming of pet dogs and cats is crucial to reduce the environmental contamination and risks of human exposure to its proper hygiene. Washing hands, cleaning produce, and avoiding contact with soil or dog feces can help prevent accidental ingestion of Toxocara eggs. Public education, raising awareness about the risks and prevention strategies can help reduce the incidence of Toxocara infections in the community. Number 6 is pathogenicity. Like I already told, visceral larval migrants. This syndrome occurs when the larvae of Toxocara canis migrate through various tissues, including liver, lungs, heart, and central nervous system. Symptoms can include fever, abdominal pain, cough, and in severe cases, neurological symptoms such as seizures. And the other one is ocular larva migrants. In ocular larva migrants, the larvae migrate to eye, causing inflammation and potentially leading to vision impairment or blindness. Symptoms can include eye pain, redness, and decreased vision. The severity of Toxocara can vary depending on factors such as number of larvae ingested and individual's immune response. Children are at higher risk of infection due to their behavior, such as playing in contaminated soil. Number 7, past research. These are the references regarding past research done on Toxocara canis.